We're fixing our broken health insurance system that's crushing families, eating away at workers' take-home pay, and nailing small businesses with double-digit premium increases. And that's what I'd like to focus on for a moment. After a long and thorough debate, we are on the verge of passing health insurance reform that will finally offer Americans the security of knowing they'll have quality, affordable health care whether they lose their job, change their jobs, move, or get sick. The worst practices of the insurance industry will be forever banned, and costs will finally come down for families, businesses, and our government. Now, it'll take a few years to fully implement these reforms in a responsible way. But what every American should know is that once I sign health insurance reform into law, there are dozens of protections and benefits that will take effect this year.
There are a set of reforms that begin to take into effect this year, so I want to talk about this. This year, millions of small business owners will be eligible for tax credits that will help them cover the cost of insurance for their employees. Starting this year, tens of thousands of uninsured Americans with a pre-existing condition and parents whose children have a pre-existing condition will finally be able to purchase the coverage they need. This year, insurance companies will no longer be able to drop people's coverage when they get sick, or place lifetime limits or restrictive annual limits on the amount of care they can receive. This year, all new insurance plans will be required to offer free preventive care. And by the way, for all the students who are here today, starting this year, if you don't have insurance, or if you're about to graduate and you're not sure what your next job's going to be, or there's a little gap between getting that job with insurance, all new plans and some current ones will allow you to stay on your parents' insurance policy until you're 26 years old, starting this year. Because as you start your lives and your careers, the last thing you should worry about is whether you go broke just because you get sick. This year, for the seniors who are in the audience, if you fall in the coverage gap known as the donut hole, you're going to receive $250 to help pay for prescriptions, which will be the first step towards closing that donut hole, that gap, completely. I want seniors to know that despite what some have said, these reforms will not cut your guaranteed benefits. In fact, under this law, Americans on Medicare will receive free preventive care without co-payments and deductibles.
Thanks for listening.